For those of us that haven't met, my name's Emily. I am an accredited exercise physiologist and have been for 10 years or so. I started out teaching Pilates and then moved into chronic disease management, which is where I met the 94-year-old. And at LEAP, I teach the functional training classes on Mondays and Fridays and do some one-on-one sessions with the reformer and in the functional training room. For those of you that don't know, an exercise physiologist is an allied health professional, like a physiotherapist, but we use exercise to assist in the management of chronic conditions. And we work alongside other allied health professionals like physios or osteopaths and GPs and also specialists. So tonight's webinar is all about exercise and knee pain. There are many causes of knee pain, so I'm going to be keeping it quite general this evening. We're going to be doing just hopefully a couple of practical things as well, so you won't need a huge amount of space, but if you've got just a mat, you can do most of them from the chair, to be honest, but if you've got some space on the floor, and if you've got a small cushion or something like that to hand, some people use, if you've got those sort of chi balls or physio balls, got one of those. I've had a very clever person using a roll of kitchen paper, so it's something with a little bit of give, but if you don't, it's not the end of the world. Yeah, so there's sort of a few things that we'll be discussing as we go through, but I suppose you're probably here because you've got knee pain. So as we go through, and these are things to consider, you know, as we chat, and if you need to see a physio or anything, but things like, when did your pain start? Did it sort of just suddenly come on during an exercise or during a particular movement, or did it gradually creep up on you? What type of pain is it? Is it sharp pain? Is it dull pain? Is it worse in the morning? Is it worse when you're doing a particular movement or exercise? And does anything make it feel better? Yeah, we'll get into that. So because that's why you're all here, hopefully. So the knee joint is one of the largest and most complex joints in the body. There are many muscles and ligaments that work together to provide stability. And then we've also got cartilage and meniscus between the thigh bone and the lower leg bones that provide shock absorption. So there's quite a lot with the knee that can go wrong. I'm not going to go too deep into the anatomy for it, but it is quite a complex joint. It bends and straightens, and there is a little bit of rotation as well. So it's got a few movements as well. So it's not necessarily a straightforward joint. The most common sorry, I keep nudging my table and shaking. The most common type of pain is at the front of the knee, anterior, it's called, at the front of the knee. And I suppose if you've heard these terms, then you've probably seen someone already, but patellofemoral pain, which is kind of just an umbrella term for injuries or issues with the front of with problems with the kneecap, and patellar tendinopathy, which is problems with the patella tendon, which is one of the thick tendons that runs through the kneecap to the kneecap. In terms of pain management, so there are some really simple, and I'm talking kind of more the acute side of things. So acute, what we talk about when we're referring to acute pain clinically, is the short-term, quick onset pain, as opposed to chronic pain, which is going into the arthritic realms and things. We often refer to acute pain sort of in layman's terms as quite intense pain, but that's not what we're meaning by acute. So if you've just hurt yourself, for example,